Hello, my name is Patrick Brown, Mayor of Brampton, and welcome to our weekly briefing on the City of Brampton's COVID-19 efforts to help protect our community and diminish the spread of this virus. Today, I'm joined by City Councillor Harkirat Singh, who will give a bylaw update, and also Dr. Lawrence Lowe, Peel's Medical Officer of Health, who is working on the front lines on behalf of healthcare in Peel Region. At the start of today's briefing, I wanted to say I understand that the GTA continues to be an area that is facing the spread of this virus, and Brampton is one of those hotspots. In past weeks, we've talked about the eagerness that some have in this province and in the country for reopening, and we certainly continue to be nowhere near that stage in the city of Brampton, and are going to continue to take things at a very cautious pace to make sure we're protecting the health of our residents. I should also note I've had a number of inquiries from residents since the Premier mentioned that Brampton was one of the hotspots, asking where are those hotspots. I wanted to say that I've spoken to the CEO of the hospital and to Dr. Lowe on the importance of transparency and making that information available as soon as possible, and I'm heartened to hear that we have their commitment to make that data available as soon as possible so residents know where there are areas of greater concern and areas where the virus seems to be circulating in the community at a greater rate. I should also note that I've been speaking to the Premier almost every day about how we deal with this hotspot. And one of the tools that I really welcome is the Premier's commitment for increased capacity for testing. Just speaking this morning to our hospital CEO, I understand that yesterday was one of the busiest days for testing. 1,184 people were tested at the assessment center in Brampton, and we're certainly going to take the Premier up on his offer for increased testing. On Monday, I wrote our employees at the City of Brampton asking if they would participate in the testing. In order for public health to be able to trace and track the virus, we need to know where it is. And that's why we've taken the unusual step of asking all our city employees to get tested. Since the government has said that it's no longer going to be a condition that you have symptoms to be tested and you can get tested without symptoms, we're certainly supporting that wholeheartedly and encouraging our community to get tested. I want to thank our local labor partners, the Brampton Professional Firefighters Association, who supported this with their membership, our Amalgamated Transit Union, Local 1573, that supported this request as well, and our local QP, Local 831. So all our labor partners have supported the importance of asking all our employees to get tested. We've even gone further. We wrote the members of the Board of Trade and the Downtown Business Association asking for all those who are involved in retail or businesses that have been reopened to get tested as well. And so this is a real push in the City of Brampton to make sure we scale up testing so we can have a handle on where the virus is. And I want to thank all our partners who have supported that, and to the province of Ontario and Peel Public Health for everything they're doing to ramp up testing capacity. I also wanted to speak to today about long-term care. Yesterday, we saw the scathing report from the Canadian Forces on the five residences that they were located in. One of those residences, the Holland Christian Homes, was in Brampton. And I should say, reading that report, it certainly makes your stomach churn. Reading that PPE wasn't being changed, that people were left with food in their mouths when they were going to sleep. That's not how we expect loved ones to be treated, and I'm glad the Canadian Forces have put a light on what is a deplorable situation within long-term care homes in our province. I can tell you that for me it's even more personal. I've mentioned before that my grandmother, who's 106 now, is in a long-term care home in Toronto, and I've seen firsthand through my own family the challenges they are. It's one of the things I spoke to the Premier about yesterday. I know he's passionate about it as well. His wife's had similar experiences with her. parent with her mother, and I really believe this is something that we're going to be judged on as a country, how we cared for the most vulnerable, and we have to do better. We must do better. One suggestion I gave the Premier was I'd love to see whistleblower legislation, so that if a caregiver is noticing something that isn't appropriate, if they can't get access to PPE, if they don't believe that the talking points that are coming out are consistent with what's happening in the home, they need to have a mechanism to share that information safely without the threat of losing their job. And I welcome the Premier's interest in that initiative. The last thing I wanted to mention today is we have some more opportunities for public engagement in Brampton. On Friday at 3 p.m., the city is hosting our first teletown hall for the arts, culture, and tourism sector. And sometimes this is a forgotten sector as we look at the challenges of COVID-19, but our arts community has been hit hard as well. We're holding a public teletown hall specifically to look at how we can support the recovery of our local artists. The second opportunity for public engagement is on May 28th from 7 p.m. to 8 p.m. Councillor Marta Medeiros, who is the chair of the city's Reopening and Recovery Advisory Group, will host a Facebook Live event with Dr. Lowe to answer questions from the public. I know we're getting lots of suggestions of what should be reopened or how we could protect the safety of residents, and this is an opportunity for you to ask those questions directly to the medical officer health. But I want to reiterate that as we study reopening, we're doing so in a manner that will not be driven by any timetable, by picking any date out of thin air. It will be driven by the advice of our physicians. It will be driven by the advice of Dr. Lawrence Lowe and what he sees in his data with Peel Public Health, and Dr. Naveed Mohammed, who is doing great work at running the Osler Health System. So on that note, I'm going to ask Dr. Lowe to come up to give his weekly update on the public health scenario, on the challenges with COVID-19 in Peel Region, and following Dr. Lowe, we'll hear from Harkirat Singh before going to questions. Dr. Lowe?
Thank you, Mr. Mayor, and good morning to everyone. As of this morning, we have observed 2,089 cases in Brampton. 1,461 of those have recovered, and 70 Bramptonians have tragically passed away. I first want to begin my remarks by thanking our paramedics for their service. This is Paramedic Services Week. Working hand in hand with Peel paramedics in addressing COVID-19 has been an honor and privilege for us at Peel Public Health. So Brampton, Peel's 7-day moving average of new cases has trended upwards over the last week. And I want to be clear, that is not the direction that we want to see things going in. Our investigation has identified that this is being driven by new outbreaks in household clusters and also centered in workplaces. While we continue to dig down for the root cause of these outbreaks, direct cases to isolate, and trace and advise for contacts on next steps, I want to be absolutely clear that we are far from being out of the woods with COVID-19. Also, with the upward trend, I wish to state that I very much welcome the province's recent announcement to broaden COVID-19 testing to any symptomatic individual, any asymptomatic individual who has had close contact with someone who may have COVID-19 or has confirmed COVID-19, or asymptomatic individuals at risk based on their work. More testing will help us identify cases more easily and allow us to stop spread and protect residents. I do want to also state, though, that as we support more testing, we also must test more of the right people. And to that end, I urge Bramptonians to be patient and thoughtful in seeking testing. In speaking with our hospital partners, I have been advised that area assessment centers will continue to test all who need to be tested. And if you are considering a test, however, I encourage you to carefully consider your risk. We hope to afford opportunities as much as possible to those who are symptomatic or who are at risk, first and foremost. Testing those individuals will give us the best chance of identifying and stamping out chains of transmission in our community. I also wish to address the idea of geographic data. Geographic data, like testing, can be helpful, but must be used with other tools to inform the public and inform our response. geographic data that we have, the geographic data that may be developed on testing data speaks more to where cases live rather than where they may be exposed. And Brampton's population is highly mobile and interconnected in the Greater Toronto Area, which means that acquisition of the disease could actually happen far away from home as opposed to in the area that may show up on a geographic map. What we know now is that based on our current situation, cases are spread out across Brampton and across the region of Peel, which is why people must continue to take precautions when you are out and about, regardless of where you might be in the community, and especially when enjoying outdoor facilities that have recently reopened. And these principles include staying 2 meters away from others, not gathering in large groups, practicing good hand hygiene, and wearing a non-medical mask in settings where distancing is difficult, such as on transit and in grocery stores. We must stick closely to these principles, especially as the community gradually reopens, and we must reverse the increase that we are seeing. Remember that the higher up the curve we go, the longer it takes to come back down. So I call on Bramptonians to follow our strong recommendations to distance, to practice hand hygiene, avoid crowds, and wear a non-medical mask where is needed. I also call on business owners and proprietors to do their part, ensuring that their premises permit employees and customers to protect themselves in this manner. And for our part, Peel Public Health will continue to provide you with information and in coordination with our hospital and healthcare partners, continue on the broad continuum of testing, tracing, isolating, and treating. But we absolutely cannot do this without you. Please, when you're out, continue to do your part and stay apart. Thank you, and I'll pass it back to Mayor Brown.
Thank you, Dr. Lowe. Next up is Councillor Harkirat Singh to give an update on our bylaw efforts to make sure that everyone's following the advice of public health and physical distancing.
Thank you, Dr. Lowe. Thank you, Mayor Brown. Good morning, everyone. I'd like to thank our bylaw team and first responders for the outstanding job that they are doing to keep our community safe and to ensure we are mitigating the spread of COVID-19 by preventing large gatherings. Between May 19 and 25th, there were a total of 56 charges laid under the Emergency Management and Civil Protection Act. We saw an increase in complaints received for residential social gatherings from 163 to 291 this past week. As a result, 25 charges were laid. Additionally, 27 charges were laid related to parking lot gatherings. One particular evening, 23 charges were laid by bylaw enforcement officers who partnered with Peel Regional Police to respond to these gatherings. There was also one charge for an unlicensed business selling produce in a parking lot and 3 charges for using equipment at a park. I would like to take this opportunity to reiterate what is and is not allowed in terms of social gatherings in Brampton. Under the Emergency Management and Civil Protection Act, social gatherings of more than 5 people are prohibited. This means that a meeting or assembly of more than 5 people who do not live together in public or on private property is prohibited. This also includes parked vehicles as well. We know that as this goes on longer and the weather gets warmer, it makes it even more difficult to not see family and friends. I want to encourage everyone to think of one another, to think of your own family, to think of your community, to stop the spread of COVID-19 in Brampton. Let's protect the safety of our community and emerge from this stronger together. Thank you.
Thank you, Councillor Singh. On that note, we'd love to take any questions. I see we have Graham Friss from the Brampton Guardian first.
Right. Just a quick question about the, can you guys hear me?
We can.
Yeah, okay, great. Just a quick follow-up there on what you were talking about, the identifying the hotspot or hotspots. I'm just curious, what's the holdup on getting that information out to the public?
Well, first of all, I should state I I've had a number of members of the public email me, call, and asking for that data, wanting to know if their neighborhood has a higher level of spread of the virus, and I agree with them. I think they have to have that transparency. I know Dr. Lowe wants to make sure that they receive that data in the right context, so that if you're tested somewhere, we're not learning where they are tested, but where they actually live. And I'm going to ask Dr. Lowe to speak to that, but I can tell you, myself and Mayor Crombie and Mayor Thompson have urged public health to expedite the release of this data as quickly as possible.
Sorry, Graham. Yeah, Graham, if I may, I'll just respond as well. Certainly, I've been in conversation with all of our mayors here in the region of Peel, and have heard the interests around geographic data as to why I mentioned it in my remarks. The important thing, as I mentioned, is it's one of these tools that we are trying to figure out how we can best communicate in terms of providing appropriate context and nuance. We certainly want to avoid stigmatizing neighborhoods, and we certainly want to make sure that people are sticking to, as I've said, the precautions throughout our region, because even though there may be an area identified within geography, it does not necessarily speak to where that individual may have been exposed, and it doesn't necessarily speak to the risk in other areas being lower per se, because these people, individuals, our residents are very mobile, and they could be anywhere within our community. So we are actively looking at this question, and our intent would be to try to provide this data, but with appropriate context and nuance to ensure that the public is able to interpret it in a manner that allows them to protect themselves while not necessarily stigmatizing communities or neighborhoods.
Just one follow-up. Also, I mentioned there at the top that there have been outbreaks at some businesses. Is the city or region intending on releasing that information to the public as to where these businesses have been, where these outbreaks are happening?
So I'll let Dr. Lowe speak to whether those names will be released. I would add that I spoke to the Premier about this, about getting mobile testing for these businesses, getting that capacity to be able to actually take testing to some of our busier workplaces, Amazon being an example, and I believe that's going to be happening in the near future, and that's an initiative of the province that I certainly welcome. And in terms of the transparency of which businesses have been affected, I'll let Dr. Lowe speak to that.
Thank you, Graham, for the question. As you know, when it comes to workplace exposures or any exposure in general within our community, what we do in public health is we try to balance both the need to publicly disclose if there is a risk to the public versus the respect for privacy of the health information of the individuals that are impacted, as well as the businesses that may be impacted. And the typical practice of public health has really mirrored similarly a physician with their diagnosis. In the event that there is a risk to the public, we will absolutely be out there sharing information to ensure that the public can protect themselves. But if there is no risk to the public through the course of our investigations, if we, for example, are able to identify cases and then identify their contacts in a manner that first of all does not speak to any public risk, and second of all does not require public disclosure, then we are no more able to release that any more than a physician would be able to release a patient's diagnosis. So I hope that helps understand the balance that we have there, and certainly how we would definitely take steps to protect the public if there was a risk to the public identified in one of those workplace outbreaks.
Cam from 680 News.
This question, hi, can you hear me now?
We can.
Perfect, hi, how's it going? This question might be better as Dr. Lowe.
Okay.
There was a report out on the Councillor this morning just about health officials. They are releasing some new guidelines and thresholds. So my question was, how much power do health officials have? So if the Premier says restaurants are open, can you stop them from opening, for example? Or if the Premier says they are closed, can you open them up? That was my first question.
So I think specific to the questions around the enhanced indicator framework that we are looking to launch in Peel Public Health, a lot of the perspective around why we took that approach is actually to really provide that information to our decision makers like Mayor Brown, like Council, for those decisions to be taken. So really, our goal, at least in developing that framework, was to be able to provide and put some numbers and data that we could then put in front of decision makers to advise how things look in our community in line with the province's own framework to reopen Ontario.
Okay, and I guess my follow-up for you, this goal of unity between regions, especially from the health officials, if there was one region, for example, let's say the province said barber shops can open, but Toronto said no, and Peel says yes, are you worried people would flood to Peel, for example, to get a haircut or use whatever other service may be open?
Yeah, certainly that is a reason why all of the health officers continue to work with Dr. David Williams and with the Ministry of Health to try to identify an approach that both balances the needs of the province and really the different pictures that they're seeing in many different jurisdictions, but also recognizing the unique needs that we have, at least for me, in the region of Peel with what we are seeing around the pandemic picture. So to the extent that we can try to avoid situations like what you're describing, I think it's one consideration as we continue to look at the reopening announcements that are issued by the province of Ontario.
Okay, thank you, Cam. Next up, we have Nida from The Pointer.
Hi, good morning. My first question is for Dr. Lowe.
Okay.
So your region continues to make up a large chunk of Ontario's new COVID-19 cases, and it was mentioned that increased testing will take place in Brampton and the larger region. Are you concerned that this won't happen at the rate needed, given the concerns around testing in Ontario?
Nida, thank you very much for the question, and I think that speaks to my remarks that I started with, which is while we support increasing testing overall, we also need to be testing more of the right people. And I think we continue to work and wait for the provincial testing strategy to really understand how we might be able to prioritize certain groups for testing, recognizing that, of course, Ontario Health's criteria is very clear. It's individuals that are symptomatic, individuals that are asymptomatic contacts of individuals who are symptomatic, and also individuals who are asymptomatic but may have a higher risk due to their line of work or their duties. And I think seeing how that gets operationalized through the provincial testing strategy is something that we are waiting for, and we'll be able to figure out what it means for Peel when it's released.
Thank you. My second question is for Mayor Brown.
Yes, Nida?
So on Monday, Premier Doug Ford said parts of Peel region are part of the hotspot, and he specifically named one part of Brampton. How do you feel about this label, and are you concerned about the stigma that could come from sharing the hotspot location in Brampton?
I think transparency is the best recipe when we're dealing with a pandemic. And so I'm glad that there's a move afoot to release what areas in the GTA have higher circulation of the virus. And, I have a good sense of, from my conversations with the Premier, for where they are in the GTA, but I would love for the entire community to know. I think that's, we owe that to the public. We have Ravi from AB News.
Good morning, Mr. Brown. My question is directly to yourself. Can you hear me all right?
I can.
Okay. Regarding the international students, we know that they are the integral part of our community, but at the same time, we are witnessing a lot of social conflicts in various locations, specifically like Sheridan College in particular and the area, and where there's a lot of evidence found on social media where this group of people or the students are violating social distancing at the same time, challenging the system by making social media posts, which is very highly disturbing for the local residents. Why the police or the bylaw officers are not taking strict exemplary actions against these people?
Well, I'm going to let Councillor Harkirat Singh speak to this as well, who's, Councillor Singh has played a leadership role in helping international students in Brampton. But I would say bylaw is taking a strict approach. Some of the parking lot parties we've seen, there's been fines this week and last week, significant fines. And so, listen, we're trying to help everyone who is in a difficult position, but at the same time, everyone needs to follow the physical distancing guidelines from public health, and there's no exception to that. Councillor Singh?
Thank you for your question, AB News. So we are taking this very seriously. Obviously, the videos you're talking about, the social media posts that have gone viral. Regarding the one near Sheridan College in particular, I can confirm with you 23 charges were laid. Speaking to our Director of Bylaw today, Paul Morrison, I can also confirm with you that we are working closely with the Peel Regional Police, particularly to these parking lot gatherings. And I can also share with you yesterday, half a dozen charges were also laid. So we're taking this very seriously, and we will be pursuing those who are violating social distancing, whether in social gatherings in their homes or in parking lots. Thank you.
So my follow-up question is that how we can help these people understand or counsel them that to integrate themselves into the system or mitigate them. What reasonable efforts do you think that cities will come up with in the near future?
Well, we're doing our best to make sure everyone is aware, working with our academic partners on that as well. And I think by and large, the vast majority are following the guidance of public health. There's always a few bad apples that give the entire community a bad name, but that is not the norm. And I should thank some of the organizations in our community that have stepped up to provide assistance, whether it is meals or financial help to international students who have been stranded with the school year ending so quickly. You look at the Dixie Gajora amongst other social services in our community that have really stepped up to help international students. Lucy in Brampton.
Good morning.
Morning.
So my question is, with Brampton Transit passengers now being recommended to wear non-medical masks, are there concerns with some of the public who are still choosing not to wear masks in general? And could that eventually lead to a mandatory measure put in place in the city of Brampton on public transportation and beyond?
Yes, it is a concern, and we're monitoring this right now. Public health has said that when you're in close contact, you should be wearing a mask. In our Brampton Transit buses, we are following the physical distancing guidelines. Having said that, there's still a number of people on a bus together. There's people lined up to get onto a bus at the stop. And so I'm going to be monitoring this very closely with our transit commissioner. And if we don't see people wearing masks, that they're not following the recommendation, the strong recommendation of public health, then we're very much considering making it mandatory.
Thank you very much.
Jasleen from PTC. Jasleen, can you hear us?
Hi, can you hear me?
We can.
Okay, my question to you is, we know that 5 Ontario long-term care centres in Ontario are receiving military help. One of the long-term care centres in Brampton South. Looking at the military report released yesterday, what initiatives the city will take to ensure the safety of seniors, and how will you address the issues military raised in its report?
Well, first of all, I was grateful that the Canadian Forces came to Holland Christian Homes as Grace Manor. It was a tinderbox there. It was such an old home with so many residents. We were really, really concerned. And having the Canadian Forces come in, it was like having the cavalry come in terms of the assistance. So I thank the federal government and the Premier for that that designation of help in Brampton. Having said that, the report was jarring. The report made your stomach churn in terms of the fact that we need to do better in long-term care facilities. And so I hope this is a wake-up call to all the administrators, everyone running a home, that they need to do better. Our country will not be viewed in a positive light in terms of how we've cared for the most vulnerable. It has to change, and it has to change immediately.
Follow-up question is for Dr. Lawrence Lowe. We know that Brampton surpassed Mississauga in the number of people who have tested positive for coronavirus, even though Mississauga has a larger population, and now the Brampton has been called the hotspot. What is your response on this, and keeping public safety in mind, what additional health guidelines or safety measures region will bring?
Thank you, Jasleen, for the question. I think my advice and my recommendations are in line with my remarks at the opening. We need to be very clear that we are not done and we are not out of the woods with COVID-19 yet. As I've said before, we have a fire that is under control, and I think it's up to each of us here in Brampton and throughout the region of Peel to stick to the physical distancing and hand hygiene and avoiding crowding measures, and then also the strong recommendation to wear a non-medical mask where you can't do that. If we are all able to collectively do that, and business owners and proprietors are able to step up and do that as well in terms of making sure that people, their properties are able to facilitate that, we will beat this, but we absolutely need to do it together. Thank you for the question.
Next up is Terry Miller from Brampton Carp and a former columnist with the Brampton Guardian.
Thank you very much. The Premier made a comment, at least told us that they have a few hotspots in Brampton. For seniors, that's very important. It's very important for us to know where those things are. And I heard Dr. Lowe talk about nuances. And I'm saying for seniors going into those places now, that's a danger. So I wonder if when this information is going to be available.
So I've asked for this information to be made available as quickly as possible. And I know Dr. Lowe and Dr. Mohammed at Osler Health are going to try to make it available as soon as possible. In terms of a specific timeline, it's not going to take weeks. I think it's going to be a matter of days, and the sooner the better, in my opinion.
Just to follow up on that as well, I must say that both of you, all of you, are doing a very good job, and seniors appreciate that. But we do have to know where the danger spots are, because if we don't know, we're going to be added to that list, and we are the most vulnerable.
Yeah, agreed completely. And I'll continue to push to make sure that information is released as soon as possible. Thank you, Terry. And next up we have Sandeep. Yes. Sandeep? Okay. Yes.
Can you hear me?
We can.
First of all, I want to thank Team Brampton for coming forward and updating us. I have one question. Despite of lesser population than Mississauga, we have more number of cases in Brampton. Any particular reason? I would like to ask Honorable Mayor Patrick Brown.
Well, Mississauga and Brampton are close in size, but Mississauga still is a larger population base. The numbers are relatively similar. We've gone back and forth before in terms of having higher numbers, but for me this is a reminder that we have community spread in Brampton, and that we have some challenges in making sure that we diminish this. And I don't want to see the virus grow anywhere. I don't want to see it spread in Mississauga. I don't want to see it spread in Brampton. And the reality is, if you look at how Ontario is doing, there is a very different scenario in the GTA than in more rural areas or small communities. I think part of that has to do with population density. Part of it has to do with the fact we have multiple families living together. So when it hits one family, it could hit 15 people in some cases, because there are some traditions in Brampton where you have multiple generations living together. I'd also say the workplace outbreaks have contributed to that as well. Thank you, Sandeep. Next up, we have Nitin Chopra from Prime Asia.
Mayor Brown, first of all, wish you a very happy birthday. My question is for Paul Morris.
Yes, okay.
Paul, your team is doing an amazing job, and we know there are many challenges day to day. My question is, are air pistols allowed on Brampton streets? If your answer is yes, then there is a bylaw number 93-2005, which states that by the purpose of bylaw, the following definition apply. Gun shall include any firearm, air gun, pellet gun, or spring gun of any class or type. If your answer is no, then there were some videos which were viral on social media, and the people, they investigated everything in detail, and there was no charges, no fine. That's the outcome of that thing, because they said that was an air pistol. So question for Paul Morris.
So Nick, thank you for the question. I can tell you that we did refer that matter back to Peel Police, and it's in their hands. I can't comment on their investigation or the charges that may or may not be laid. You would have to ask them.
Paul, that's the investigation I'm giving. There is a bylaw 93-2005, and the question is that are air pistols allowed on Brampton streets?
Air pistols are on the streets? No. I mean, you wouldn't want to produce an air pistol on the street. The replica of the air pistol to the handgun is just too similar. It would be an issue for us and would be an issue for police, so we would not want that.
Okay. Thank you, thank you, Nitin.
But people have, yes.
Yeah, so I think that's a question that we can ask our chief. I would note that at our press conference next week, we're going to have the chief there. But you know, a replica gun and you know, would be more of a it would be a police responsibility, and so we can arrange for you to ask that question directly to our chief next week.
Okay, thank you very much.
Next up, we have Rajinder Sani from Parvasi Media.
Yeah, man, belated happy birthday to you.
Thank you. It was yesterday, but thank you.
Yeah, I know. That's why I said belated. Okay, we have information that many cities are putting cap on these food delivery companies like Uber Eats and Skip Addition. But in Brampton, we see lots of restaurants that are struggling to keep their doors open. So 30% of the revenue, major chunk of the revenue, these companies are taking. New York, San Francisco, and a long list of those cities, they have already put a cap on that. Can Brampton also consider that?
So I'd say, first of all, I think the premise of your question that our restaurants are hurting is very appropriate. I can tell you that the city has launched a campaign to shop local, to support local restaurants. We have Takeout Wednesdays. We've got social media we've been pushing out. I can tell you myself, me and my wife, every Wednesday support a different restaurant, and we're asking people to share their experiences online. These are mom and pop shops, small businesses that their families have thrown their hearts into, and we want to see them get through this difficult period. In terms of the delivery charges, I know a number of the local restaurants are doing delivery on their own to diminish those charges. I know a restaurant I ordered from yesterday, actually, it was doing their own delivery. In terms of the charges for some of these companies and whether the city could regulate that, I'm going to ask Paul Morrison to speak to whether our bylaws have any jurisdiction over that.
Yes, sir.
No, at this time we couldn't ban Uber Eats. It's a service delivery that fits the format of what the province has put down for rules and regulations for a service, an essential service. So as long as the social distancing is taking place, we're content that they're doing what they should be doing on behalf of avoiding COVID transmissions. No, that'll be a provincial matter.
Good question, and we can look into that further, Rajinder, but it appears like that would be a provincial regulation in terms of what they're allowed to charge under consumer and commercial relations.
Yeah, my follow-up question is, last night we had a very serious accident on Highway 50. Two trucks collided and we have lost the life of a young truck driver. We see regularly accidents on this Highway 50. This is one of the most accident-prone roads in our region. Police have many times put surveillance on that. Can you bring to the notice of the Minister of Transportation or we have to do something because regularly serious accidents are happening on Highway 50 on this stretch.
Thank you for the question, and I was reading the report from Brampton Fire and Emergency yesterday, and it's heartbreaking. Tough, obviously the families, their lives are going to be shattered, and I feel for our emergency responders who have to, they throw all their effort in the world into trying to save that life, but sometimes these accidents are fatal, and I don't want to see them. No one does, and so we will look at this if there are things we can do to enhance transportation safety. We will certainly flag it with the Ministry of Transportation because you're right, these accidents have become far too frequent. Thank you for the question. Our last question is Shazia Malik from 7/7 a.m.
Yes, hi. I have two questions, and I'll just make it very quick. First of all, I must congratulate you that your team is doing a great job, but still there are some concerns. The first concern is that Bridge has increased its rates. So has the city been able to talk to the Premier to, contain those rates, number one. And number two, these are difficult times and people are not really getting out of their houses very frequently. They just are coming out if it is absolutely essential. And during this time, some hooligans, they create a racket and they don't let those poor women, shop in peace. So has the Brampton government taken care of about both these things?
So, great question. That the Premier has made a commitment that utility charges are going to be controlled during this difficult period of economic adversity. And if there are examples where Enbridge bills have skyrocketed, we will certainly flag that with the provincial government. In terms of criminal activity during the pandemic, there's zero tolerance for that, and I know with our chief, Nishan Dirappa, that if we're made aware of areas, we'll certainly make sure that police are available. We've got a team of frontline officers that are really responsive to the community. I'll give you an example. Last week we heard about speeding in the Mount Pleasant area, street racing, and so this weekend they did a blitz, and some of these hooligans who were thinking that they could street race in our community are now facing the impounding of their cars and criminal charges for street racing. So there are consequences, and by sharing your experiences, it does make a difference. And if the individuals that contacted your radio station about people being harassed in a shopping environment, we'll pass that on to the Peel Police. If you want to share it to Mayor Brown at brampton.ca, we will certainly share that with the Peel Police. So that covers all our questions today. I want to thank Dr. Lawrence Lowe for once again giving a detailed briefing on his office's efforts in Peel Region with COVID-19, and Councillor Harkirat Singh, who continues to play a leadership role in the City of Brampton, and grateful for his support of our efforts here in the city. Thank you so much.